Last week, we learned that actress Angelina Jolie recently had a preventative double mastectomy when she found out that she carried the BRCA1 gene, commonly referred to as the breast cancer gene.
East Texas women tell us they too have had to make that difficult choice because their risk level for developing breast cancer was so much greater than the average woman's. KLTV 7's Shaylee Sanders spoke to a surgeon about this genetic test and a woman who took preventative measures after losing her sister to cancer.
I may die of cancer, but it's not going to be breast cancer.
Jennie Ferguson's mother and sister were diagnosed with breast cancer. Her younger sister didn't survive. She said she didn't need to be tested for the breast cancer gene to go through with a preventative double mastectomy.
It was not going to be if I got breast cancer, but it was going to be when I got breast cancer.
Surgeon Michael Norton says they've known about BRCA, the breast cancer gene, for about 15 years.
We've been able to identify the gene that's associated with an abnormality within the breast tissue that is part of a healing gene that occurs. The risk of getting breast cancer with a BRCA gene can be somewhere between 60 and 80%.
Actress Angelina Jolie recently announced that she went through with the test and a preventative double mastectomy after learning she had an 87% chance of developing breast cancer, a number she says decreased to under 5% after the surgery.
The decision of when to treat a BRCA gene can begin at the time of diagnosis of the genetic abnormality, or it can be done in a gradual way through life. We recommend screening at age of 25.
Surgeon Norton says the decision varies from person to person, and a lot of times it depends on the age of the individual. For both Jolie and Ferguson, their decision to have a double mastectomy is something they say they don't regret.
Haven't looked back. I would do it all over again, and I was very glad that I made that decision.
Shaylee Sanders, KLTV 7 News.
Dr. Norton says genetic testing requires a blood sample, and it will take about a week or two before you receive your results. He says the price of that test does vary based on your family's history.